Apologies for the delay. I just am a bit worried about my connectivity, but we'll see how far we go and we hope it goes through. Thank you so much for taking time to listen to my presentation. Titled Education as Health, Enabling Inclusive Policies to Inform the Lived Experience of Disability. Let me just reduce the volume there. So we know that education itself is an issue of health. It's crucial to human capital development. It's about opportunities. It increases the quality of life of people. And so education, there's a direct correlation between education and the quality of life and status of well-being that people enjoy within our societies. And the quality of life of persons with disabilities are equally impacted by their access to education or not. And based on the historical marginalization that they have experienced, and in terms of access and other health disparities that have kept children with disabilities and their families from accessing education, there's been a lot of challenges in terms of the quality of life of persons with disabilities. And also the World Report on Disability estimate approximately 93 to 150 million with disabilities globally. And out of this, 6.4% of these children reside in Africa, with less than 10% of all children with disabilities under the age of 14 in schools. And therefore, this has compounding within Africa, particularly compounded with the issues of poverty and issues of stigma and discrimination. This has further affected the lived experience of disability, further compounded the challenges of education, access to education as a social health determinant. So I would just like to define policy here as a state of becoming, something that is continually contested. So policy continues to evolve. So policy is live. It's not just a piece of document that is kept aside. It's informed by ideals, it's informed by values, and the context and actors inform policy. So we see that we keep revisiting policies to see how policies are enacted and if it fits the changing context within which it is enacted. At least this is the ideal. This is what it should be. Just some background on the policy context. So of inclusive education, we have various national and international instruments that support and actually advocate for inclusive education and the value of education for all children, and not just for children with disabilities, children from rural areas, children with other kinds of needs, children, transgendered children, all kinds of children who need some adjustment to be able to access education on an equal basis with children, other children all over the world. Therefore, the tenets of inclusive education is around embodying philosophical frameworks and understandings of the purpose of education. This includes the attitude and values and belief systems of particular communities. It's also about membership and belonging and acceptance, and about including education for everyone, like I said before. Disability policies are often aimed at reflecting what government priorities are in terms of inclusion. So disability policies enact government priorities, acknowledge meaning, and accord meaning to the life, to the lived experience of persons with disabilities in a more formalized statement. And these policies often direct the unique experiences, lived experiences of persons with disabilities to facilitate access and inclusion. However, within the African continent, we've had some particular challenges related to inclusion. In terms of policies, we have the influence of a deficit model. So you often have this approach of where it comes to the deficit model of thinking around when it comes to Africa, the challenges we have will probably mitigate access. We look at the written content of the policies. Sometimes it's not very clear and it lacks detail. Sometimes it's not contextually relevant. The international instruments that speak to inclusive education, and there's always been the need to interpret it and also implement it within the context that it's meant to be implemented in. Therefore, there's also the need for more inclusion of locally relevant knowledge within policies. Within the African rural context, there's so much research and literature around the lived experience of rurality and indigenous contexts, around health, ecosystems, politics, and all of that. It's covered within literature and research around the rurality and the experience of the rural context. However, there's a need to understand that these are all systemic, that there's a connection between these concepts. Although it's disciplinary in its presentation, but however, the lived experience of it is often interrelated. A child who does not eat at home will not be able, the child will not be able to go to school, will not be able to listen if there are bad roads, the child will not be able to get to school, there needs to be access to the school building, and you find that agriculture speaks to engineering, engineering speaks to education, education speaks to policies and political will and priority keeping by government, and all of this speak to health and well-being. So approximately 60% of this population reside in Africa, and in rural communities, and persons with disabilities within rural communities are twice much more, experience more health disparities, experience more marginalization and exclusion than their counterparts within urban settings. Therefore, there's the argument around including community knowledge. In terms of contextually relevant policies, actually the UN flagship on disability and development state that people with disabilities still experience barriers to full inclusion. Issues of stigma is still a challenge. And the contextual and cultural lenses that are used to explore disability, even within policy making, is also a challenge. Girls and women tend to be more vulnerable and more marginalized. And research has also shown that in areas of education, independent living, healthcare, employment, and so forth, there's a need to open up spaces for policy engagement so that local knowledge is a part of the influence policy outcomes to address the discrepancy between policy formation and implementation within our community context. So I won't spend time on this. This is just a study, introduction of the study, from a critical framework that we came from for the study. I focus on an analysis based on the understanding of previously marginalized knowledges. The study then explored the inclusion of local knowledge within policy making, inclusive education policy in particular, national inclusive education policies in South Africa, Ghana, and Uganda. And the first phase of the study was a document review of these 3 documents of the National Inclusive Education policy documents and government statements. And then the second phase were interviews of storytelling of use of visual prompts as required by the participants. So just a brief, in total, you won't see it here because it's kind of covered by this, my apologies, but in total in the 3 countries, we're able to work with 25 people, we're able to assess 25 people across education, local government, persons with disabilities, policymakers, and specialist inclusive education institutes. We're able to identify 25 participants for the study, and they were interviewed in relation to the study focus. Content analysis was used to analyze the policy documents, and thematic analysis was done for the interviews. So the definition of rurality that we're working with is about this. So what stands out here is that here it says education, whether formal or informal, that is provided to and for people residing in rural areas, whose aim is to enable them to live efficiently and effectively in their environment. And so we are very focused on this environment, living efficiently and effectively in the environment. There's a need for persons with disabilities to be able to thrive within the environment, not have to travel out of their immediate location to access education, to access healthcare services, to access whatever that is required. The idea is for the environment to be supported, to provide for children with disabilities, to be able to access education on an equal basis with children in urban areas who do not have to travel so far to access their education and have excellent access to education around their neighborhoods. So education is a social determinant of health. It's about valuable knowledge and skills. It's about transmission of culture through generations. So why this particular definition has been chosen is that in exploring local content and knowledge within policies, we had to acknowledge the fact that it's about culture. And culture is often within the African setting, and I use the word Africa loosely because there are so many connotations to the word Africa currently. It's a contested term, so that disclaimer. The transmission of culture through generations within the African context is often is passed through generations, and so the promotion of social and economic programs comes through this knowledge that is maintained and transferred to the next generation and after. And often children with disabilities are not part of this transfer, and this impacts on their identity, on the issues of the psychosocial issues and the existential issues of existence as well, and this impacts on their well-being. So the initial findings, this study, the analysis is ongoing right now, and so I'm just presenting on the initial findings from the study. And what I've done is to just pick, because of the time limit, I just pick a quote to identify a strong theme across all three countries. What I do, select just one quote to represent that. However, even if it's only Ghana that is there, this particular sentiment was identified across the three contexts. So for this first one, I have the three quotes talking about policy, that the policy document is not only the written document, that actually policy can be spoken, and that African communities have agreements and policies that are not spoken. However, this is often sidelined. That it's important to bring that in, that implementation and formation of policies need to, when consulting, is not just an information session to let communities know what has been decided, but to actively engage communities and ask, what kind of policies do you have? Even if they are unwritten, what kind of policies, what guides you, what rules, what regulations do you have within your community that can inform education for children with disabilities? This is about inclusion as human diversity. So this is from Uganda, and they talked about inclusion is about recognizing the fact that we are humans. So inclusion needs to be more than what we identify it to be. That is about diversity, comes with needs. That inclusive education is about the diversity of humans. And if in a classroom, the diversity of differences within children is not recognized, then that is not being inclusive. That we cannot focus on just a child with one disability. There could be a child with multiple disabilities, different disabilities. There might be children without visible disabilities, but struggling with cultural differences. Uganda gave an example of nomadic families that move from space to space, and how inclusive education must make room for that. How children move from communities to communities as their families move because they are nomadic and they get left behind, and how that has to be part of the diversity that inclusive education looks into. And also this from Uganda talks about communities are also responsible to create enabling structures. Now, this quote is from Uganda, but like I said earlier, it's across the entire country. The three countries feel that people from the communities also have a role to play. So this person, this respondent from Uganda, talks about how a child with a disability, that even when the parent says you can go to school and seek a better quality of life, that often the child can be beaten on the way, the child is insulted, and so this child will not want to go to school because he doesn't want, she or he does not want to put their life at risk. And our communities need to be more responsible and also ensure that the pathway to school is supported by the community as well, that they have that role to play. And from here, South Africa will have a quote around the White Paper 6 that there was an intention to kind of create a common knowledge and understanding around inclusion. However, that this has not been sufficiently done. So the current national policy has not taken note, has not really engaged with communities sufficiently on what are the existing coping mechanisms, what are the strategies that are used in the home, that there needs to be a connection between the home and the school, that the school cannot be disconnected from the home, especially if we are building a structure around the children with disabilities. And then from Ghana, a participant from Ghana here, I use this quote to capture what occurred across, again, the three countries, talking about the integration of Indigenous and ethical and moral accountability within policies. So this participant is talking about how when that within the African communities, we have ways, sorry?
Can we just be careful with time? We can just start to wrap up fast. Thank you.
I'm sorry, I can't hear you.
I'm saying if you can wrap up quickly because time is
okay.
against us.
Okay, I'll do that. So this is what they say around that. We need to look at that as well and look at what we have within our communities. And then the influence of international funding agencies and the focus of that, we need to be focused on what works within our local context, and it cannot be driven by donor funding. So we need to be aware of that as well. This is a quote from Ghana. And then South Africa, we also have about the creative use of resources, talking about the Northern Cape, where a rural school actually made adjustments, and schools who were more resourced gave reasons why inclusive education is expensive. And what they're saying here is that it is not. We can look around us and identify what we need to move forward. So these are some of the limitations of the study in terms of connecting, poor connectivity, and also participants that participated. And just the conclusion that education is a right for all, absolutely, education supports well-being. The inclusive education policies must recognize and include Indigenous ways of knowing to support rural policy implementation. Rural communities can support inclusion through non-stigmatization and agency building, and then policymakers to be held accountable to the communities that they serve. And creative identification of and use of resources to support inclusion and contribute to resilient well-being. Thank you very much.
Thank you very much, Mr. Lola. Very much. Do you have any questions? Okay. No, thank you very much. We don't have any questions. Thank you for the presentation.
Thank you.